Hi, this is Eyton Shalom at the Body Mind Wellness Center, and I wanted to show you what I'm doing on this patient who has chronic low back and hip adductor pain and tightness. And I don't know if you can see well enough because of the lighting. So I have needled the psoas muscle from the back, and I've done that by counting the lumbar vertebra so that I'm at the space between L3 and 4, and I'm 1.5 inches lateral to the spinous process of L3, 4. And I have taken a number 8 3-inch Seren needle and needled. So that's actually, I don't want to scare anyone, but that's actually 3 inches, almost 3 inches in, because that's what you need to do in order to get to the psoas. And so it's not terribly uncomfortable. Depends what you're used to, and I don't do this on patients the very first time I see them. The psoas, I'm also going to, when I turn him over, I'm going to needle the motor point of the ilaiacus that works with the psoas as a hip adductor. And I've taken some of the needles out already, but I've also needled some of this paraspinal muscles here, and also the sacroiliac joint, and also the gluteus medius minimus. And so I'm going to take these out now, and this is, take a nice breath, and this is the gluteus medius minimus, which was very tight on this side. He recently went hiking and described pain on this side. And then I'm going to the SI joint point. I don't stimulate it very much, just a little bit of twirling like that, just to help get some of the inflammation out of the SI joint. And then these paraspinal muscles, take a nice breath. I'm just going to, so with releasing trigger points in the muscles, we use this lifting and thrusting technique that you see me doing here. Keep breathing, say stop if anything's too much. So as I take them out, the muscles relaxed a bit, and I can stimulate it and get a little bit more of a release. These muscles were very tight. I did the same exact points on the other side. I've just already removed them. And now I'm going to take out the psoas. So this side was nice breath, keep breathing. His psoas is so tight, I just got the needle in and haven't stimulated it very much. So I pulled it out a little bit. I'm just going to do a little bit, instead of lifting and thrusting will be too painful for him because it's so tight. It's like needling into unworked clay, but I am going to just twirl it a little bit, pull it out a little bit more. I'm going to put the phone down, the camera rather, because I need to use my left hand to guide it as I push down. And then so now I'm going to do a little bit of, stop me if it's too much, a little bit of lifting and thrusting. Okay, all right, so that's out. And now I've already lifted and thrusted this one, so I'm just going to, you okay? Okay, good. Okay, so now they're all out, and that's what I wanted to show you, is how to release the motor point of the psoas from the back, and it actually corresponds to the acupuncture channel point bladder UB27, which is 1.5 inches lateral to the spinous process of L3. Okay, thanks for tuning in. If you like this video, please click the like button and subscribe to the channel, and feel free to comment or ask any questions. Thank you. And thank you to my patient for allowing me to do this.